Come in.
Hey, Mr. Willen. My name is Lauren Stewart. I'm a nursing student at the University of South Alabama. It's nice to meet you.
Nice to meet you.
Is it okay if I do your respiratory assessment today?
Yes, ma'am.
All right. I'm going to perform some hand hygiene. And I'm also going to state that the normal breaths per minute is 12 to 20. I'm going to check and see if you have any accessory muscles to breathe, which you don't. And I'm also going to check to see your depth of respiration. So I'm going to state that there's shallow respiration, which you wouldn't see a lot of rising in the chest or falling. There's moderate, which is normal, and then there's deep, which is a lot of movement in the chest. So I see that you have a normal one, and now I'm going to check your AMP transverse diameter. So it's front to side, so we're going to go like this. So you can see that you are 1 to 2 in AMP diameter in your chest, so that's really good. Now I'm going to assess the anterior and posterior thorax. So you would have your shirt off, which you already do. I'm going to check it for any kind of lesions, any kind of bumps. I'm also going to check your hair, which it seems like you don't have any, so I would assume that you do shave your hair on your chest. But if you did have it based on your stomach hair, I would think that you had terminal hair. So I'm going to check that, and I'm also going to compare the color of your chest to that of your arms, your face, and it should be compatible. So looking at your chest, I see no kind of lesions, any kind of bumps, anything cause for concern. I see that your skin tone is like the skin tone of your face, to your legs, your arms, so it's really good, it matches up. So now I'm going to look at your mucous membrane. I'm going to check your lips. So I see that your lips are pink and moist. There's no sign of cyanosis. Would you open your mouth for me? I see that your buccal mucosa is pink and moist. There's no sign of cyanosis. And I see that your uvula is pink, so there's no sign of cyanosis in your mouth. So these are really good. So now I'm going to look down at your fingers for me, so kind of see on your hands. So we see that your fingers are pink and convex. Your capillary refill time is less than 3 seconds, so that means there's no clothing presence, and your fingernails are less than 160 degrees. So there's no clothing present, so I'm going to make this diamond, just like that. So there's a diamond, so there's no clothing, and your fingernail beds are less than 160 degrees, so this is really good. So now what I'm going to do is I'm going to check for, I'm going to palpate your chest, and I'm going to see if I can find anything abnormally posteriorly and anteriorly. Alright, so nothing seems to be out of shape, or everything looks to be good in my palpations. Do you feel any kind of tenderness or anything like that?
No.
So now I'm going to have you stand up for me, and I'm going to check your chest expansion. Alright, I'm going to have you breathe deep. Exhale. Turn around for me.
Like fall back.
Yeah. Breathe deep. Alright, very good. So we see with your chest expansion that it is symmetrical both anteriorly and exteriorly and anteriorly and posteriorly. So next I'm going to oscillate your breath sounds. So I'm going to have you breathe through your mouth, and I'm going to tell you to take deep breaths. All right. So now I'll have you turn so I can listen to it posteriorly. So turn for me real quick. Or you can just turn around. Alright, very good. Sounds great. So first I listened to your bronchial breath sounds, of the lyrics and everything, and it sounded good. So it sounded with high pitch, and intensity and inspiration was less than expiration. So the next I listened to were the bronchial vesicular breath sounds, and they are located both anteriorly and posteriorly. They are located over major bronchi, which is based in the center of your chest. They are moderate pitch and moderate amplitude, and inspiration is equal to expiration. The last thing was the vesicular breath sounds. They are located in the peripheral lung field. They are only heard anteriorly. Or they can be heard anteriorly and posteriorly. Sorry about that. They are soft, low pitch in inspiration, and greater in expiration. And after listening to all these sounds, your breath sounds were normal during oscillation with bilaterally, anterior and posteriorly. I didn't hear any kind of abnormal breath sounds like crackling or any kind of sounds of, which would be signs of pneumonia, or any kind of wheezing, which would be signs of asthma. So your respiratory assessment was good. So.
Thank you.